Hey everyone, Sid here at the AAFE Training Center. We are just going to be doing some lips and talks on my patient. So first I'm going in with just standard volume. She already has a really nice shape, so we're just kind of enhancing what she already has. So you can see I'm following really close to that vermilion border. I'm tenting up to check my depth. You always want to be mid-dermis with anything in the lip. You never want to be too superficial. As it can, sometimes look like it's bluish or a gray tint, which we call tindling. And you obviously don't want to be too deep, as most of your vessels are below that dermis. So you have a greater risk of complications if you're too deep. Just again, going on the opposite side, so really close to that vermilion border. The closer you are to that border, the more kind of vertical show or flip to the lip that you're going to get. So it's kind of a nice way to prevent any migration if you don't want to do right angle on your patient. This is a great alternative. So we're really just throwing some filler in there to give her some more hydration and a little bit extra plump. But like I said, she doesn't need much reshaping. So I'm just going to kind of peak her cupid's bow a bit. And then here you can see I am doing a little bit of right angle. One, to help kind of define that cupid's bow a little more. And two, she needs a little hydration kind of in that middle area of her upper lip. So this will help define that as well. Coming down to the bottom, again, same thing, staying really close to that border. I'm always making sure that there's no odd discoloration with the tissue after I'm filling. In these syringes, I usually don't aspirate. However, if I use the syringe that the filler comes in, it definitely, I will always aspirate with it. These syringes sometimes are just so skinny that you won't always get a positive aspiration even if you're in a vessel. So I always just make sure to really watch my color of the tissue and just kind of making sure that my patient's not having any complications. So just making sure you're really careful if you do use the Comfort Tox syringes, if you backfill the product, just making sure that you're really cautious about your depth and just watching the tissue. So now I always like to go in and massage the tissue of where I filled, basically just smoothing everything out. If there's any kind of bumps and lumps of the tissue, I'm going to smooth that out. And then I'm just going to kind of be OCD a little bit and go back into the areas that are bothering me or that I can notice or the patient can notice. So as you can see, I'm kind of filling in those areas. She almost has a little bit of an M-shaped lip, which are really difficult to fill at baseline. So I'm just trying to make them less M-shaped. But you can see how she has a little bit of spacing when her mouth is closed. That is meaning that they're more of an M-shaped lip. So they need a little bit more volume in those areas that most people do not. And then again, just going back, doing a little bit more massaging. And then I always make sure to put on my Comfort Tox Post Lip Care Kit. It has arnica, essential oils, hyaluronic acid, so it's really great for swelling and bruising. And then it's also great just for, after pictures. And then obviously your patient can go home with the rest of the kit, which this is what I'm applying right now. It's the balm, and they can go home with it. I always tell them to use it for the next 3 to 5 days or so. And don't use any other lip products in the meantime. After the healing period, I'm okay if they use something different. But now we're going to move to the tox. Okay, she wants her frontalis, glabella, and crow's feet treated. So I'm first finding my lateral borders by having the patient raise. You can also have the patient clench down, and that's where your temporal fusion line is, and that's kind of where the end of your frontalis is. So just marking it one of those two ways is perfect. Then finding her procerus and medial and lateral corrugators to make up the glabella and get rid of those 11s that everybody hates. And then the crow's feet, just staying outside of that orbital rim. I usually like to stay at least a finger breadth, anywhere from 1 to 2 centimeters outside of that orbital rim. So you can see I'm going in at about a 45-degree angle. And I'm giving the amount of product that I determined by the patient. So I usually determine this dose by how much they're moving, how kind of still they want to be. Some patients really want to be still. Other patients want more natural and a lot more movement. And then also by the set of their eyes, and then if they have any hooding. So the more hooding they have and the less movement, I'm going to go way more conservative. If somebody has shallow eyes, I'm going to be very conservative, whereas someone with no hooding and deep eyes, I'm going to be a little bit more aggressive. The glabella is a depressor at baseline, so when you treat it with neurotoxin, it's going to help to elevate and open the eyes. So I always, kind of heavily dose this area. Thank you guys so much for watching.